I had my dad's nose. I see him and all the things that he's done to hurt me.
Now in a must-see follow-up appointment.
I can't wait for you to see your new nose.
Who is ready to see Veronique? That's today. Coming up.
I've always been self-conscious about my nose. Today is my surgery day.
Surgery went perfect, and Veronique, I can't wait for you to see your new nose.
Earlier this season, we met Veronique, who had been bullied from a young age about her nose. Some children even compared it to Mount Everest. Not only that, her nose was a painful reminder of her estranged father. Let's take a look back at her story.
I've always been self-conscious about my nose. Getting my nose fixed would be like a dream come true for me, but it's not just for vanity reasons. I started realizing I had my dad's nose. My dad and I have never had a good relationship. Every time I look in the mirror and I see him and all the things that he's done to hurt me, he left me and my mom when I was 5. When my grandma passed away, who was my best friend, he just wanted to know how much money he was getting. It's just really hard for me to know that I am related to that kind of person, because I'm not like that.
I think you would be a good candidate to have your nose done. What do you think?
I think yes.
Well, you are in luck today, Veronique, because we have Dr. Deepak Dugar from the Scarless Nose Institute.
I want to give you as much value as I can by giving you a Scarless Nose Rhinoplasty at no charge to you at all.
Dr. Dugar heard Veronique's story, wanted to shape her nose to boost her confidence. This is the surgery. Let's have a look.
It's so nice to see you again. Are you excited about this? Are you nervous?
So excited and nervous. Today is my surgery day. The surgery means so much to me. I can't believe that it's really happening.
Today we're doing a closed Scarless Rhinoplasty on Veronique. This is a procedure where all the incisions are made inside the nostril,
So no external cuts and scars at all. All right, let's do this. So what we're doing is we're making an incision inside the nose to access the profile. We're going to shave down the cartilaginous profile and remove slivers of cartilage. And then what we're doing now is we're removing just a tiny little piece of bone from the top of her profile. We want it to be perfectly smooth. So we're going to use a rasp to help file down the bones of the nose. What we're doing now is we're accessing the caudal end of her septum. This is what's pulling the nose down just a little bit. By removing this little piece of cartilage, it gives the nose the ability to rotate just a little bit more. There's a muscle at the bottom of the nose called the depressor nasi muscle, which pulls the nose down. We'll actually remove about 30% of the muscle to prevent the downward pull of her tip when smiling. We're going to narrow the bones. It allows us to squeeze the bone in just a little bit. So now we've narrowed the bones. What we're doing now is we're closing the incisions inside the nostrils really meticulously. No external cuts or scars. So we're all done with the taping and casting. Everything went amazingly well. Surgery went perfect. And Veronique, I can't wait for you to see your new nose.
Facial plastic surgeon Dr. Deepak Dugar is here. Who is ready to see Veronique? Come on out.
Thank you.
Welcome. Looks like you have a happy patient there, doctor.
Yes, yes.
Veronique, how you feeling?
I feel amazing. It's been 6 weeks and it's incredible. I still can't believe the drastic change.
Well, I think that the keys there is that she looks so natural. It's a nose that fits her face. She does not look like she had a nose job.
That's absolutely right. I think the older technique of doing a textbook nose job that a lot of surgeons used to use, we no longer do that. And we want to make it just match the face, like you said. And there's 2 main ways to do that. And I think the key is just to balance the harmony of the face.
And what was your recovery like?
It was fast. I mean, it feels just like yesterday, but I had no pain. I didn't take any pain meds, and it felt like a stuffy nose.
How's your confidence now?
It's incredible. For example, the other day I actually went for lunch by myself, and I saw a woman who was eating lunch by herself, so I offered her to come sit with me, and she was a writer, and she travels all around the world, and we ended up talking for about an hour, and that's something I would have never done before.
Wow.
Good for you.
Awesome. Couple tips for anyone considering nasal surgery. Make sure, I think 2 points. Make sure you go to a board-certified surgeon. Number 2, somebody who does a lot of nasal surgery. Somebody that makes doing rhinoplasty a large part of their practice. That's the key.
Yes, sir. I cannot completely agree.
And if you ask your surgeon, is this something you do a lot, will they give you an honest answer?
I hope.
I hope. But then you can say, well, how many do you do a week, or how many do you do a month? Can I see some pictures? Can I talk to some patients?
Yeah.
Those are all
Because I can say, watching the footage of the surgery, you wouldn't want someone doing that who doesn't know the anatomy so very well, because it would be really easy to mess that up.
And I talked to the two of you. I know we have to go, but just last week I worked with the USC resident, the fellow, in teaching nasal surgery. The most difficult thing to teach as well.
Yes, sir.
Because only one person can really see what's going on, and it's all done by feel, as you saw Dr. Dugar, touching and feeling. And so it's difficult to learn, difficult to teach. That's why you sort of have to commit yourself to that procedure.
Good stuff. Let's take a quick break.